guys, so today's video is going to be a Q&A on my forehead reduction that I got done in Turkey. All of the questions have come from you guys that you made on Instagram, TikTok, and here on YouTube. So I'm super excited to be able to answer all of these questions for you today. I am going to have my phone out because I put in my notes all the questions that you guys had. So let's get into it. So probably the most common question that I've gotten is who is the surgeon and how much did it cost? So the surgeon's name is Dr. Ahmet Dilber. He's based in Istanbul, Turkey. I will insert right here his Instagram page. And the cost of my procedure at the time that I did it was 3,000 euros. So first I had to do a 500 euro deposit to kind of save the date that we had picked out, and then when I got to Istanbul and I had my appointment, I paid the rest there in cash. The 3,000 euros, that included the procedure and it included the hospital stay, anesthesia, labs, and my consult with the doctor both before and the consult that you have a few days after your surgery before you go home. How did I communicate with them? So first of all, I DM'd the doctor through his Instagram page. His assistant contacted me through WhatsApp. So our entire communication was through WhatsApp. I know it sounds sketchy, but I mean, it's international. They're in a whole other country. So WhatsApp is the app that literally everybody uses to communicate when you're talking to somebody abroad. So WhatsApp is the main form of communication that we used. In terms of communication, I absolutely loved my experience with them. The assistant was very thorough. She answered all my questions. Keep in mind, there is a huge time difference. So when you message them, you might have to wait a few hours to get a reply, because when you message them, they might be sleeping, and then when you're sleeping, they're awake because of the time difference. So keep that in mind and don't freak out if it's taking a little bit for them to respond. It's because there is a huge time difference. Another question that I kept getting was in regards to all of the risks. So I don't know all the risks at the top of my head, because when you get there, you're gonna sign a huge consent that's like pages worth of information of all the risks of everything. The main ones that stuck with me are hair loss. You lose sensation on your head for a while because of all the nerves that get severed. Another risk, of course, risk of when you undergo anesthesia. Personally went under general anesthesia. That's how he does his procedure. You are intubated, so there is a tube that goes into your throat so that you can breathe while you're under anesthesia. So when you wake up, your throat is super sore because of that tube that was inserted. And with that type of anesthesia, there are risks that come along with that, but honestly, those risks, you need to go over those risks with the doctor himself. He explains them all to you. And of course, you're going to read the entire consent, and whatever extra questions you have on the risk, he's more than happy to answer those for you. But in my case, the adverse side effects that I have experienced is hair loss and just loss of sensation, and of course scarring. For pain control, you don't get any narcotics. You get NSAIDs. So the pain medications that I got was Adveles, and then for breakthrough pain, paracetamol, which is basically like Tylenol. And that was honestly more than enough. So the Adveles, that one was done every 8 hours, and then the paracetamol, you could do it like every 6, kind of just for breakthrough once the Adveles started wearing off. But it wasn't excruciating pain. If you guys watched my previous video, you can see that I was literally being a little tourist, walking around and going to eat and walking for hours, and I was totally fine. As long as I took the medication, I was fine. And if I didn't take it, I mean, yeah, I would be uncomfortable, but it wasn't a pain that wasn't tolerable. I would say the first couple of nights are the worst, but just take your pain medication they give you and you're gonna be just fine. I don't know how high your pain tolerance is. I have a crappy pain tolerance. I'm the biggest baby, and I didn't think it was bad at all. So just talk with your doctor. If the pain medication that he gave you is not enough, then I'm sure he's willing to work with you and maybe prescribe something else for you that could work a little bit better. So the pain only lasted for about a week. After that, I didn't have any issues. I didn't have to take anything else. It was just that first week where I was kind of just taking my pain meds around the clock, just so that I could be comfortable and actually enjoy my time being a little tourist there. Another question was mainly from the ladies is, when can I wear makeup? So with my doctor specifically, he said that I could start wearing makeup once the incision was fully closed and healed, once all those scabs are gone, and once the stitches come out. So as soon as I noticed my incision was fully closed, once I didn't have any little stitches like poking out, and I noticed that they all fell out and that my skin was closed, that's when I started to wear makeup. I haven't been putting a ton of makeup on it. Like when I'm going out, I usually have my hair covered with like a headband or like a headscarf or a hat, just because I don't want the sun to hit it. I'm trying to prevent it from getting darker. But if you do wear makeup, just make sure you ask your doctor first, send him a picture, show him what it looks like, and then go from there. So for my girlies that are little gym rats, you can't do like strenuous activity for 6 weeks. So that was really hard, and that threw me off completely off my routine, and I ended up taking like over 2 months off. It took me a while to get back into it, but you can't do strenuous activity, and it has to do with making sure your incision heals properly, making sure nothing like opens back up because of the force, and just making sure that your site stays like clean. The healing process, you guys, I really want to prepare you mentally for the healing process, because everyone is talking about, oh, is the scar visible after 2 weeks, after 3 weeks? And I'm just like, guys, come on. Yes, like it's major surgery. You're having a huge incision right across your forehead. Yes, there's going to be a scar, and the healing process, he's going to tell you, it takes time and you have to be patient. He told me that to see like the full result, I have to wait 6 months to a year, and the scar is going to be really red and dark and prominent at first. I don't want to speak for everybody, because everybody's skin is different, everybody heals differently, everyone has different skin tones. But for people who are a little bit more tan like me, or have a little bit more melanin in their skin, your scar is going to be like reddish purplish. You can look at your own scars and see kind of how you tend to heal, and like that you can kind of get an idea. But for me, my scar is still pretty red and purple. I'll show you guys in a little bit. I'll give you an update on my scar. But just prepare to deal with having to maybe feel a little bit self-conscious the first time you're around friends and family and they're seeing this like huge like scar on your forehead, and just prepare for having to be really patient and waiting for your scar to lighten up. Everybody's case is different. My hairline, if you guys saw in my previous video, I'll insert a little picture right here. My hairline was very irregular. I did not have a hairline that just went straight. I had a hairline that, of course, it was way further back, and it was like jagged, like it was like super irregular. So in my case, you can do a hair transplant 6 months after the procedure in case there are gaps that are missing hair. So when he brought my hairline down, I mean, he honestly did an amazing job because my hairline right now, although I have hair loss, which I'll show you guys, it looks irregular. It's honestly straighter than it has ever been, but I think that's a reason why my scar is a little bit more obvious than in other people that I've seen that he has done. I feel like other people's scar has been able to hide better in their hairline. I don't know if it's because all their baby hairs grew back or what, but as of where I am right now, it just seems like my scar is like lower than where my hairline is at. But again, I think that's because of the hair loss that I'm experimenting. So only time will tell, you guys. I'm only 2 months post-op, so fingers crossed that my scar will be less visible once all my little baby hairs start growing back and kind of helping covering up the scar. People were asking me if it was worth it, if I'm happy with my results, if I recommend my doctor. Yes, yes, and yes. Guys, this hairline forehead reduction for me was something I have been wanting since I was like 11. No, probably I remember feeling insecure about my forehead at like the age of 9, and I think at the age of like 11 or 12 I somehow found out that it was a thing that you could do hairline reductions or like hair transplants, and I have been wanting to get this done for years, you guys, years. And I know it sounds kind of sad to say that a little 9, 10, 11-year-old is thinking about getting their forehead fixed, but that was my main insecurity. I was bullied for it. Just something that I always wanted to fix about my physical appearance. So yes, to me it was 100% worth it. It's been a total confidence booster for me. I'm just so excited for the scar to heal a little bit better so I can start doing cute hairstyles that I didn't like to do before because I didn't think it looked good on me because of my forehead. Just make sure it's something that, you know, you're willing to go through and you're willing to go through the healing process, because again, I really want you guys to mentally prepare for the healing process. It is a long one. It's not a quick little, okay, yeah, I'm gonna have this done and then in a week or two I'm gonna look fantastic. And yes, I mean, I think I look great. I think it looks fantastic, but you're gonna have the scar that you're gonna have to help heal and take care of, and that is what can become taxing if you're not mentally prepared for it. Honestly, you guys, there are so many great doctors in Istanbul for this type of surgery. There was two that I was looking into, Dr. Dilbert, and there was this other one. I honestly can't even pronounce his name, but I'll tag him right here. I was really considering him as well, but I just ended up going with Dr. Dilbert because, I don't know, just something about his page and looking at his before and afters, the communication I had with his assistant, it just kind of sold me. And then the price as well. Dr. Dilbert, I think, is a little bit more affordable than the other doctor, but also the other doctor's pricing included like hotel stay and everything, and the one that I did with Dr. Dilbert didn't. So honestly, I think at the end of the day it's the same thing because we paid for hotel and all of that like separately. It wasn't like included in the package, so I honestly think it was the same thing. So hair loss is one of the adverse side effects that you can experience, and I knew that. I just didn't really think it was going to happen to me. So I have 2 little bald spots, okay? I have one right over here. Let's see if I can find her. Oh, there it is. See, I already know exactly where it is. There's that little spot right there. Okay, so here is my other little bald spot. And honestly, when I found them, I low-key freaked out. I immediately messaged the doctor and he was like, that's totally normal, it's going to grow back, don't worry. And they just gave me reassurance, but still it freaked me out so bad. I've never dealt with like hair loss or anything like that, so it was a little scary, I'm not gonna lie. I'm gonna show you guys the hair loss I'm having around my hairline. So right here, this area right here, all of this, I'm having some hair loss like in this section, but as you can see, I have like tiny little baby hairs coming through. And this is kind of how my hairline already was. So I don't think I'm having too much hair loss here. I am a little bit because I can see a bunch of tiny little baby hairs like growing in here. But this one right here was a big one for me. But I do see the little baby hairs coming in. And then here, hairs are coming in as well. This is already what my hairline looked like prior. This section, it was already like that. Let me tell you guys a little bit of what I'm doing for the hair loss. So I'm doing PRP injections, which is plasma injections in my hairline and back here where I have some of the hair loss. Hair oiling once a week with the rosemary hip oil, and my hubby, he's the sweetest, he's been massaging my scalp every night for like 5 to 10 minutes with a serum that's meant to help like stimulate hair follicles and help maintain a healthy scalp and all of that. So serum, hair oil, plasma injections, and just like massaging my scalp to help increase the blood flow to my scalp to help stimulate those hair follicles. And honestly, I think it's working, because it could be working, or maybe it's just because time is going by and my hair is growing back. But right here in my two little bald spots, I see little tiny, like tiny little short hairs poking through, and I have my hubby look at it all the time, every day. I'm like, hey, look, and he looks and he's like, yes babe, like I see little hairs growing, don't worry, like they're gonna come back. So they are growing back, so I'm thankful for that. How to take care of your scar. So first of all, while it's still healing, you always want to keep it clean and protected, covered up with the little steri strips that he's gonna show you. And then once you can remove the plaster and he says it's okay to remove it, you're gonna use your scar cream and you're gonna keep it clean again, and you're gonna keep it hydrated. You're gonna keep it protected from the sun, SPF if you're gonna be outside and have it exposed, which I don't recommend having your scar out and exposed like that because it's just gonna get darker. So headbands, cute little head scarves, hats, and yeah, just like anything that can protect your scar from the sun, because the sun will make your scar darker. So I don't have makeup on the scar right now, but when I do put makeup on it, it's honestly not even visible. Like you can't tell. I've been using a green color corrector, and then I just put a little bit of concealer over it to cancel out like the redness and the purpleyishness color of it, and can't see a thing. It's like nothing happened. One last thing I want to talk to you guys about is a hair transplant. So if my hairline, like the hair doesn't grow back completely around my hairline like I want it to, and I am keeping in mind that my hairline was already irregular, it wasn't completely straight. Even prior to the surgery, I probably already could have used like a hair transplant in like the sides. But if the scar in like 6 months to a year, if it's not fully faded how I want it to, while doing the plasma injections, and maybe I'll do like some laser treatments, I am considering a hair transplant just to cover up the area of the scar and to fill in areas where I feel like I'm missing hair, like right over here, which I already had before the surgery. That's just how my hairline was. This is not from the surgery. Same with like over here, like to fill in gaps here, which that's just how my hairline was already before the surgery. So I am considering a hair transplant in like 6 months to a year if I'm not totally happy with my hairline once the scar is fully healed. The number one question actually is, How is your scar looking? How is the healing going? I am 2 months post-op. I was actually 2 months post-op yesterday, but I'm 2 months post-op today. Today for me is May 27. So 8 weeks post-op, and man, you guys, my scar has come a long way. Give you a little close-up on it. Honestly, I think it's doing so good for it being so recent. I'm gonna insert a couple pictures showing you guys the progression of my scar. But again, I want you guys to keep in mind everyone heals differently. Everyone has different textures of skin, different thickness of skin, different amounts of melanin. So just keep that in mind. Everyone's healing is going to look different. Some people are going to heal maybe a little faster. It's going to be a little better. So take my experience as just something that you take into consideration, but don't think that what happened to me, how I'm healing, is going to be how you're going to heal. Anyways, you guys, so that is all for the questions that I got from you guys. I hoped this helped answer a few questions that you guys had. If you have any other additional questions, I'm happy to answer them in the comments down below. Thank you for being a part of my journey, and stay tuned for more updates on my scar and my hair loss. And I hope you stick around for other new fun videos as well. Bye!